Hello everyone, today we are discussing a hot topic that is trending on social media, which is 轮廓固定. Hi, I'm Keman, and today we have Dr. Terence Tan from Halley Medical Aesthetics to explain to us what is 轮廓固定. 轮廓固定, from what I understand, is actually a method of injecting dermal filler in order to supposedly achieve a more natural looking result. But I mean, I'm not the expert, so I'm going to let Dr. Terence Tan to explain it to us. So, Dr. Tan, perhaps can you tell us what exactly is this 轮廓固定? Right,
yeah, that's a good question. I think for our English listeners, 轮廓固定 just sounds like some Chinese term. I mean, directly translated is really facial contour fixation. Okay, so it is a new concept that came out from our Chinese-speaking community within East Asia. And this new method actually uses fillers. It can be various kinds of fillers, from collagen-stimulating fillers to hyaluronic acid fillers, in order to achieve anti-aging and lifting the facial contour. So when we age, our volume on our face decreases. We have got a bit less superficial fat, a bit less facial bony structural support. So the concept is to use dermal fillers injected over the facial contours to lift. So similar to what we would call a liquid lift, in order to get a natural rejuvenated facial contour, the jawline, the temple area.
Okay, but dermal fillers is also used for rejuvenation. So what exactly is the difference between 轮廓固定 and dermal filler injections?
Okay, so 轮廓固定 or facial contour fixation method is actually quite different. So I think traditionally, at least in Asian countries, we tend to fill areas of volume deficiency. So we have got our trough wrinkle, we have our smile lines and our marionette lines, and we directly fill these areas whereby we don't have enough volume. So that's well and good, but sometimes we don't really get as much lift as if you use 轮廓固定. So 轮廓固定is a little bit different in a few ways. So as we said, instead of actually just treating that area, we are actually treating the whole facial contour. And for us to do so, we're actually injecting a little bit more different places, a little bit further on the outside in order to get a lift, to rejuvenate the jawline, the facial contours. Number two, the depth of injection is also a little bit different. In a normal treatment with fillers, dermal fillers, we tend to be a little bit more superficial in order to fill up wrinkles. Whereas for 轮廓固定 or facial contour fixation, we tend to do a little bit deeper treatment, which has a little bit better ability to lift from the outside to improve loose skin and facial contour. Next, I think the technique is different. It's a bit, arguably, maybe a little bit more intuitive to the doctor to inject in a traditional manner, because you're just filling up a wrinkle. Whereas 轮廓固定 or facial contour fixation requires a little bit more understanding of facial anatomy and which areas are mobile, which areas are more fixed, in order to get better lift. The results are also a little bit different in terms of the traditional filler treatment methods. You tend to be a bit fuller in the center. For Asians anyway, commonly we fill up the central area. But with 轮廓固定, we tend to concentrate a little bit more on lift, facial contour, getting a clear jawline, getting some, a more natural kind of lift without, adding too much volume.
Okay, but it sounds like it really, requires an experienced doctor to know where to inject. Is that correct?
Yes and no. I think in terms of experience, it's always important. I mean, anything we do, you just put yourself in the shoes of any profession, lawyer, doctor, clerical worker, front-end staff, movie star, whatever. I think having experience is always important. So it's not really quite true to say that it's not important to have good experience in traditional filler methods, but I guess because being a little bit different, a bit new, and the technique being a little bit more difficult, I think experience is even more important in轮廓 coating or facial contour fixation. And therefore, having understanding of facial anatomy is important, and then understanding that traditional methods are just really one point specific enhancement as compared to 轮廓 coating, which is more of a appreciation of the whole face, the structure, and lift. So they're quite different. But however, saying that, I think that in life we ought to be flexible, and I found that if you were to combine 轮廓 coating or just facial contour treatment with fillers and traditional methods of filling up wrinkles, I think a little bit of both actually works quite well together. It makes a more natural look. And I mean, in life, it's never a polar extremes, you know, it's my way or the highway. I think in the end, if you combine both together, a lot of times it really does make a good rejuvenation method.
I see. Okay, so it does sound like 轮廓 coating or facial contour fixation is more like an overall design, whereas the traditional dermal filler injection method is like a local touch-up.
Yes, precisely. Yeah, I think that's a very good summary actually. I really don't think I can do it any better.
Okay. All right.
Yeah, it's just different. I mean, it's a bit refreshing way of looking at how we do things.
I guess. Oh, okay. So I guess it's important to have a conversation with the doctor, and it's
for sure.
always good for the doctor to be, you know, in line with the trends that's in social media.
I think so. I think that different people have different wants, and I think that 轮廓 coating being a more tailor-made kind of treatment, I think having a good conversation is more important. Telling the doctor what are your worries, what are your desires, very important. As I said, having a experienced doctor who understands you is also important, especially for people who have a little bit of loss of volume, loss of facial contours, and also for people maybe really bulky cheeks. A lot of us Asians have that. I think 轮廓 coating or facial contour fixation is really perfect for the job.
Okay. So I mean, I came across this technical term on the internet. So when it comes to 轮廓 coating or facial contour fixation, you have outer contouring and then the inner contouring.
Yeah.
What exactly is that?
So the concept is having a 3D rejuvenation because we have an outer contour or the 外轮廓 and the inner contour or the 内轮廓 or the center contour, sorry. So I think the 外轮廓 is really more looking at injecting the temples, the cheekbones, the outer aspect of the cheeks, the pre-gel sulcus, or the corner of the mouth and the chin, in order to get a good heart-shaped facial contour which is lifted and a chiseled, defined jawline. Whereas having a more central rejuvenation through 内轮廓 or our central contour rejuvenation improves the volume of the forehead, of the nasal area, or just the central areas, in order to give the lost volume some rejuvenation. And when both are done in unison, you get a very nice 3D look.
I see. Thank you, Dr. Tan, for this in-depth discussion and explanation about what 轮廓 coating is.
Okay,
Perhaps the
bye-bye.
not yet.
Not
We're
yet.
gonna talk about the dermal fillers.
Oh, darn it! I thought I could go home.
Because I mean, we do have a lot of questions from our audience about. I know your time is precious. Yeah, so we do have a lot of questions about the general questions that people get about dermal fillers.
Yeah.
So when it comes to injecting dermal fillers, I think one of the key top questions that patients or people have is it painful?
Well, yes, to a certain degree, it's uncomfortable.
Oh dear.
Yeah. But I think that there are three things that we can do to make it more comfortable. I mean, sorry, in general, it's a very quick process and it's really not too much discomfort. I'm just a bit joking just now. But there are things that we do to make it better. So I think the first thing and the most important thing is to choose a dermal filler with local aesthetic inside. I think most modern fillers have local aesthetic inside, and for those rare fillers which doesn't have local aesthetic inside, the doctor can add local aesthetic separately in order to make it numb during the treatment. So that's number one and probably the most important. Number two, we can and we will and we always do apply ice just before the injection. And when we do that, it numbs the area very effectively. It activates the nerves so that the initial injection is pain-free, and thereafter the local anesthetic within the filler does the job. There are people who still feel really, really worried, and rightfully so. If that's the case, you can actually request the doctor in the clinic to apply some numbing cream, which consists of a mixture of local anesthetics to effectively numb the nerve some more, to make it even more comfortable treatment.
I see. Okay, I mean, you mentioned brands, so I mean, there's so many different brands of dermal fillers in the market. So I think a lot of times people ask which brand is most suitable for me.
By and large, I think most brands would make products which are fairly robust and will be suitable for轮廓 coating. And fillers can generally be divided into hyaluronic acid fillers and also collagen-stimulating fillers. I won't go through all of them, but there are various brands, and you can go up the internet and you can find it yourself. In terms of 轮廓 coating, there's a certain collagen-stimulating filler which has polycaprolactone, which is especially popular in Asia. I won't name the brand, but it's especially popular, and I think that has got good lifting potential. But seriously speaking, I think most dermal fillers will be able to do the job. There are pros and cons. Certain fillers like hyaluronic acid fillers last about 1 to 2 years. The firmer fillers last longer, the softer fillers are more natural. And having a bespoke kind of treatment requires us to really choose the best filler for the job. Yeah. So whatever it is, I'm sure that most brands are decent. We do use a certain brand more than others, but you've done your research and you are particularly interested in a certain brand, a certain filler, let's discuss with doctor. And I'm sure that whatever brand it is, you should be able to do a fairly good job.
I see. Okay, thank you, Dr. Tan, for your time. If you have any more questions about 轮廓 固定, about facial contour fixation or dermal filler injection in general, just leave a comment in the comment box below, and don't forget to subscribe to our channel if you would like to keep track or stay in tune with the medical aesthetics trends that we have. Bye bye.
Thank you. Bye bye.